Ready? Alright, as you can see, this patient here has had a previous facelift before. You can see her scars are well hidden in her ear creases. And what we're going to do today, what bothers this patient is a little bit of this excess neck skin, a little bit of jowling that happens with the aging process. No matter how hard you do or how long you do a facelift, there's a limited duration of effect. Almost everybody has some relaxation along the neck and the jawline. If you pull somebody too tight, you're going to distort their lips and their jawline, which is that artificial or fake look that people get with a facelift. So it's expected as people age, they're going to have a little bit of sagging in this part of their face here. So instead of undergoing or re-undergoing an entire facelift procedure, what we're going to do today is what's called an anterior lift. And an anterior lift is just a limited procedure where we're going to address the jowls and the neckline here. The advantage of this type of procedure is that it's less invasive, and it's an excellent procedure for people who have had a previous facelift before and just need a little tuck-up type of procedure, maybe to address their focal areas like their jawline and their neck area here. So we're going to mark her up now, and like I said, use kind of part of her previous incisions. And what I'm doing here is I'm drawing on the patient's face to show kind of the direction of the lift. In other words, in this particular procedure, you can see that as gravity happens, we tend to fall downward here. So what we're going to do is kind of lift her up like this, and this gives us a place to remove that extra skin and sagging soft tissue that she has in that area there. So we're going to use kind of her previous incisions there, just along her temple tuft and also into the crease of her ear and just a little bit on the bottom part of the ear here. We'll do the same thing on this side over here. We'll see that you can see how well you can't even see her scars here. We're just going to kind of follow the curvature of her ear here, and just take my word, there are little scars there, you just can't see them. And in this case, just go to the bottom of the ear right there. And once again, I'm going to show the directions here. These little semicircles that I've drawn here basically refer to areas of lift. In other words, this is to kind of address this part of the neck here a little bit, and then this to get this part of the lower face like that. You can see there's not much sagging on this side here versus on this side here. When you lift up on this side of the face, she's got a little bit of banding right there, and it'll help with that a little bit. Again, this type of procedure is really best for people that have had a previous lift before, have a basis, have some scar tissue there that we can anchor support, and it's just to kind of clean up the neck and jawline a bit. Okay?